Mm, all right, we're gonna give it another minute uh, to get anyone else who might be joining us, but thank you for joining the Mental Health Awareness Month Effects of Infertility on Mental Health, um, led by Lauren Ratliff, who is on our Coalition for Family Building board, as am I. We're excited to have you here and looking forward to getting started and learning from her. All right, Lauren, you want to take it away?
Sure. Thanks, Ari. Um, like Ari mentioned, my name is Lauren Ratliff. I am a licensed clinical social worker, and I am the owner of a private practice called Matrescence Therapy that supports women through fertility and into early parenthood. So if you could get the PowerPoint going, Ari, that would be great.
Of course.
It's not showing up on my screen.
That's so weird. What about now? Any of these?
No,
Okay.
it's
Are
just
you,
like the
do you
main.
see the main slide? Okay.
Yeah, yeah. There we go.
Uh, hang on, let me share the link with Eve too. Okay. Sorry about that. Okay, so, huh. Can you see it now?
I can. Can you press play? I think it might look a little bit better.
How does that look?
Um, I mean, it's fine for now. You can see like the sides of it, but that's
Oh,
totally,
really?
yeah.
That's so weird. Because it's playing on mine.
All right, I'll just get started like this.
Here, let me see
Um,
if I can.
there we go.
Okay, I think that's Eve. Okay, all right. I'm sorry, this is. All right, I guess this is maybe the best we're gonna get. I don't know why it's not working.
All good. So I really commend anyone who's here listening to this or anyone who's watching this afterwards. I think when we're struggling with infertility, there is such a push to focus on the pregnancy, to focus on what's happening with our body. We can't take mental health out of this picture. It's such a huge part of fertility and getting through this experience. And obviously, if you're here, you are struggling with this yourself, or you have a loved one who might be struggling with this too. 1 in 6 people actually experience infertility, so it's far more common than I think we realize. And fertility is not just a stressful event, right? Research consistently shows that the emotional burden of infertility is actually comparable to some of these major illnesses, such as cancer, HIV, heart disease. So, again, I think it's really validating that people are really struggling through this and they're very emotionally overwhelmed and exhausted. Um, so as you'll see, the rates of depression and anxiety are quite high for people who are experiencing infertility. I actually think it's probably a bit higher than this. This is just reported depression and anxiety. Um, Many people who are going through this experience hypervigilance around cycles and symptoms. They're experiencing intrusive thoughts, panic, anxiety, difficulty concentrating, grief after failed cycles, a lot of social withdrawal with infertility, and relationship strain. So again, this really is impacting us in a pretty big way. Um, and obviously, infertility is a really cumulative thing, right? Infertility is typically not one event. So we see emotional distress really compounding, and people are really struggling with these cycles of hope, anticipation, waiting, sometimes disappointment, grief, and then trying again. And when we look at reasons that people actually stop treatment, emotional distress is one of the leading factors. Um, so this isn't just an extra component, right? Like this is really impacting continuation of care. Next slide, please.
Work.
There we go. Um, I think a good way to think of infertility in terms of mental health is chronic stress, right? This is a lot of chronic stress on both our bodies and our minds. And when we look at other medical conditions, they seem very different than this, right? If I break my leg, I know exactly what to do. I am going to the ER, I'm getting an x-ray, I'm getting a cast. I can predict that outcome is going to be very favorable for me. If I have high blood pressure, I'm going to the doctor, I'm getting prescribed a medication, I'm monitoring it. We can predict the outcome there too pretty well. Fertility, unfortunately, isn't always like that. There's not a clear timeline, and we don't always have a predictable treatment plan. Um, Many women and couples really have been in this state of waiting for months or years. Um, this is a chronic stressor. This is something that's coming up consistently over time. And like I mentioned in the slide before, this cycle of hope followed by sometimes disappointment, followed by hope again, that really wears on us from a mental health perspective. And usually the expectation is to try right again, right? Like aren't often taking breaks when we're trying to get pregnant. Again, it's a compounding effect that often leads to exhaustion, burnout, and sometimes numbness of what's going on. Um, Obviously, I think anyone who's going through fertility treatments can relate to increased anxiety before treatments. I think that's a really reasonable response to have when you're walking into something that's very unpredictable, that can be pretty invasive and can be very distressing. Um, so while that, again, is an expected response, we really need to know how to treat it and how to support ourselves better when we are feeling anxious about some of these treatments. Something we see in therapy is something we call dress rehearsing tragedy. And this is kind of our brain's natural coping strategy to help protect us when and if things go wrong. So a lot of times we'll talk to women who have already thought about, what happens if this doesn't work out? What happens if I can't get pregnant? And they're really kind of going through the motions of that, and bracing themselves for bad news. Again, it's a natural tendency to do that, but we actually think this is a really poor coping strategy that really can increase the depression, anxiety symptoms we sometimes see with infertility. Next slide, please. So I don't think we can talk about infertility without talking about ambiguous loss and grief. And I know sometimes that sounds a little funny, right? Because this is a little less concrete of a grief status than other grief can be. And I think a lot of people who are struggling with an infertility walk around with this rawness and this invisible grief that other people are not seeing. When things happen in life that are more concrete and able to understand, people are asking about that, right? Oftentimes no one's asking about what's going on with fertility, and it just feels very isolating to be experiencing that. And unlike other forms of grief, our society just doesn't have a lot of rituals and support compared to other losses. And I think of grief in many forms when it comes to infertility. And I'm speaking mostly as a woman here, but I think a lot of us thought our whole lives about what our families were going to look like. I remember playing MASH with my friends on the bus and, picturing how many kids I was going to have, who I was going to marry, all of those things. We're conditioned to be thinking about this from such an early age. And when we experience infertility, that imagined future just really changes. And again, it shifts timelines in ways that we didn't really anticipate when we thought about conceiving children. And it all often also feels like a loss of control over your body, over your timeline, over this life trajectory that many people have planned very specifically. I think anyone who has gone through fertility struggles can relate to kind of this next point. And I think we get a lot of responses from people who have the best intentions, who are really trying to support us, but often some of these comments just feel even more isolating, and sometimes harmful. So we've all heard, just relax. It'll happen when it's supposed to. You can always just adopt. At least you can get pregnant. At least your insurance covers this. At least you're financially stable. At least, right? Again, super good intentions, but when we're hearing this on the other end of things, it just feels even more socially isolating. So we've talked a lot about, what people are experiencing during infertility and what challenges we really see them presenting with. But I also think it's even more important to talk about what we can do to support either ourselves through this, a partner through this, a loved one, a friend. There are some really actionable things that we can be doing to support our mental health. I think we tend to be really good about being proactive about our physical health. Mental health is one of those things that we often are pushing to the side until we can't really push it aside any longer. And so, as a therapist, I am always encouraging people to start thinking about these things before things start to feel like they're a crisis. So, what are the indicators that we might need support? We're going to talk a little bit about that, and how do we actually get the support that we need? So, my first point, build a predictable emotional support team. So, all of us can think of people in our lives that maybe are either good in this department or great friends in a lot of ways, but maybe not in the infertility category. Um, I know that I have friends that I reach out to when something funny happens. I have friends that I reach out to when I need support when something challenging is happening. Infertility can be the same thing. So I encourage people to really think about 2 or 3 people who feel like really safe people to you. Who are the people that you want to share the good, the bad with? Who are the people that feel comforting and feel supportive and won't feel more isolating and not understand this process? And on that note, decide ahead who gets updates. I've talked to a lot of women who, they have told a lot of friends about fertility treatments or kind of their next steps, and then they're not really sure how to be communicating what's actually happening and if they want to continue talking about what's happening. So figure out ahead of time, who do you want to be on that update list? You don't have to share with everyone in your life what's going on. You can share with no people, or you can share with a big team of people. I think it really depends on what feels best to you. I think a lot of people, when they're struggling with infertility or going through fertility treatments, often are now in this position where they have to educate people about this process. That cannot be your responsibility, right? And I think it's again, well-intentioned people who are asking a lot of questions. There are a lot of good resources to send these people, so that they can educate themselves. But you don't need to be the one who is talking about IVF cycles and what IUI looks like and all of these things that you're learning yourself. That can be really overwhelming to have to explain to all the people who aren't totally sure what that is in your life. I always want to put a plug in for individual therapy. I think therapy is super helpful in all points of life, but when it becomes to a transition and an experience like this, it almost feels like therapy is a no-brainer, right? It's a support person that's going to be very neutral, that is going to be walking alongside you with this. And I think it can be really helpful just to have a touch point to help kind of monitor some of these mental health symptoms or prevent some of these things from getting worse. And you don't have to have a mental health condition to seek therapy. So one thing I do with women all the time, and their partners too, is practicing these conversations when we can anticipate more intrusive discussion, right? So we all have been to those family parties where an aunt says to us, hopefully it'll be you next Christmas, or when can we expect another cousin, or all of these things, again, really well intentioned. But how do we respond to them when we're in the thick of infertility or when we're in the thick of a treatment? So going into those situations where we might anticipate these conversations to happen with a really clear path of what we're going to say. A lot of times I talk to people about using humor. I think that can be a really great way to diffuse the situation, or using ways to deflect the conversation elsewhere. None of us want to go into these conversations. So have someone ask this, turn red and walk away, right? Like that doesn't feel good. We know they're going to happen. So how do we anticipate what we can say to make them feel more comfortable? And when it comes to your support team, I think a really good question to ask is who helps me feel more calm, sorry, more calm and not more overwhelmed, right? Again, we all know those people that feel chaotic sometimes and overwhelming. Those are not the people to have on our team right now. Creating boundaries around fertility consumption. This is so important, and I talk about this all the time. We are living in this amazing age where we can get any knowledge and information at our fingertips. Unfortunately, a lot of the things we're seeing are not actually accurate, or they're not actually helpful. Um, and social media, it's a love-hate, right? Like I think people have found really good communities through social media and feel less alone when they're struggling with infertility. But we also see women who are struggling even more than that because it feels like everybody and their sister are getting pregnant, or everybody has a new baby that they're posting about. Or even worse, we're seeing accounts with information that isn't actually true or accurate. The research is pretty alarming when we look at the accuracy and validity of research, or of facts that are being shared by some of these Instagram influencers or Instagram accounts. Many times they aren't actually accurate, and they're often selling us things that aren't helpful in our fertility journey. I saw a very big brand the other day advertising for a conception support device. And it really blew my mind. And I think it speaks to the world that we're in, and just having to really protect ourselves from what we're consuming and what we're looking at. And I think a lot of us go on social media, myself included, we're scrolling. It doesn't feel problematic. It feels innocent. It feels like a way to pass time. Unfortunately, it's not that simple, and it really can impact our mental health. I also want anyone to feel like they can give themselves permission to decline a baby shower or an event where it might feel triggering, and it might feel that there's a lot of people that are going to be harmful to our mental health. I know that feels bad. No one wants to decline a baby shower that of someone you love, right? Like we're happy for people who are pregnant. We're happy about a new baby. But at the same point, you need to prioritize your mental health first. And it's okay to be busy that day. It's okay to send a gift and wish them well. But I don't want people to feel like they have to attend these events if the fallout is going to feel very detrimental. And I think, again, to these points, like this constant exposure can really, really harm our nervous system and keep us activated in a way that can really impact mental health outcomes. Next slide, please. So I
Did that
also
go?
think,
Okay.
yep, okay. I also think that relationships can obviously be impacted by fertility, and the communication patterns that worked in the past might not be working in the same way that they used to. Um, So I would really encourage people to protect your relationship and not have it become solely about fertility. We know fertility is top of mind. We know that there's a desired outcome, but there also has to be a time and a place. Um, so as silly as it sounds, I encourage people to schedule very intentional fertility free time, right? So that might be a Friday night dinner where you intentionally say, we are not talking about fertility today. We're not talking about pregnancy, about babies. We're talking about all the other things going on in our lives. But it's really important that we keep ourselves accountable to not falling into those patterns. Um, Maintaining intimacy without goal-oriented sex. I know this is also very nuanced and very tricky, right? Because when we're trying to conceive and when we're going through infertility, the goal of sex is often to get pregnant. I really encourage people to also maintain a level of intimacy as much as it feels comfortable that isn't so goal oriented and isn't all about pregnancy. It's also really important to acknowledge partners really can cope differently, which may be surprising, right? When we're with our partners and we feel like we're going through this with them, oftentimes partners are going through the same experience, but feeling very differently about it and coping really differently about it. Might be one partner that, wants to talk about this all the time, and there might be the other partner that has a really hard time talking about it and feels like denial is a safer place for them to be. Um, there's nothing wrong with that. There's no right way to go through infertility, but I think it's in the communication that we can really explain, what's working and what's not when it comes to a relationship. There's also a tendency to kind of assign the person who's not going through fertility treatments as the strong one, right? The person that needs to be the rock, that needs to kind of be flat and kind of cope with all these things. Um, we really like to avoid doing that because again, there are typically two people going through this experience and they're often coping with it in different ways, and different challenges they might have. So, how do we regulate the nervous system during treatment cycles? This might be totally new to people. Um, we like to, when we do therapy in other aspects, right, we're thinking about breathing, we're thinking about regulating the nervous system so that when anxiety provoking events happen, we have a way to kind of dial it back and come back to our body. Grounding exercises can be really, really helpful when it comes to this. Um, Grounding exercises are basically a way to engage our senses to, again, get us out of our mind and get us back into our physical reality to help try to regulate that system. I really can't say enough about keeping structure during fertility treatments, during times of infertility. This is a really good way to ground ourselves in our mental health because when we are doing the same thing over and over, it reminds our bodies that we aren't under attack, right? It brings us back to a level of homeostasis that can feel very comforting during these times. So if you're someone that walks your dog at 7 a.m. every single day, keep doing that, right? If you're someone that loves having tea at 1 o'clock after your lunch, like these are the things that again, might sound silly and might sound minor, but they are really important to, again, support our mental health, support us through a really challenging time. Sleep protection. We always have to be thinking about sleep when it comes to mental health and our physical health as well, obviously. Um, I could talk about sleep hygiene for an entire hour, but I think really prioritizing a concrete routine. And that's the building blocks of sleep, right? That's having a consistent nighttime routine, that's having a consistent bedtime and wake up time. It's not having your screen or your phone in bed with you, only using your bed for sleep and sex. All of these things that we know probably to be true, but sometimes we forget them during periods of high stress. Um, Obviously, sleep deeply impacts our mood. We can all think of times where we weren't sleeping a ton or we had multiple nights in a row of not sleeping well. It's really hard to cope with various triggers or stressful situations when we aren't well rested. And I think it can really help with the resilience piece when it comes to any stressful event, but especially infertility. Movement and exercise. Of course, we always want to check in with our doctor to make sure that that's okay with where you're at. But if you're someone who exercised before, keep exercising. Exercise is a fantastic way to support our mental health, and it's a really good way to help some of these roller coaster emotions that we experience during infertility. So keep moving, even if it's walking or doing something light, like it can really be a game changer when it comes to this. Limiting catastrophic thinking, this is really hard, right? It's really hard to stay present. It's really hard to stay focused on what's happening now, not the 10 steps ahead of us. And we see a lot of people who are really ruminating about this stuff because how could you not? This is so consuming. But ruminating, I think it can be so hard to get out of these cycles, but it often really can impact anxiety specifically. And this is where I think a therapist can be really helpful in helping you work through some of those rumination patterns and some of that catastrophic thinking. Creating specific distraction plans. I I do this a lot with my clients. I'm working with a woman now who's going through fertility treatments. We've made very specific plans for the weeks in between all of the things that are happening, right? So she knows exactly what to do Monday through Friday when she knows that this is going to be a really heightened anxiety period for her. And again, it makes sense that anxiety is a part of infertility, but we don't have to have it be the main focus, right? We can cope through anxiety and have it just be a part of the experience instead of something that really starts inhibiting our day-to-day functioning. So, like we saw on the first slide, we do see a high degree of depression and anxiety and other mood disorders during infertility. And there are some risk factors that we can really think about on the front end to help support yourself as you're going through this. Um, so there are people who experience depression and anxiety for the first time during infertility, but there's also a lot of people who have had histories of depression or anxiety that we can, again, really work on that proactive treatment instead of the reactive treatment. People with a trauma or loss history. Um, there is a lot of amazing research being done right now on PTSD and infertility. And I think that can be a really helpful way to frame this because it really gives language to how powerful and how difficult some of these periods can be. So when we do have someone that's had a trauma or loss history, they are more at a higher risk to have a mental health disorder during an infertility or postpartum phase. Lack of support. Again, we're going to talk a little bit more about getting support in the next slide, but having a team, having people that you know are behind you, this can be hugely, hugely impactful. We see people who don't have the support often struggle a little bit more with these periods. It can really be a big factor. People who have had repeated failed cycles, this can be very obvious or it can't be, right? Those people are at a higher risk for a mental health concern. Financial barriers. Many of us know the costs of getting fertility treatment and how prohibitive this can be. Financial barriers can really also contribute to having a higher risk factor for anxiety or depression. So I think we can all probably determine what does severe depression look like? What does severe anxiety look like, right? Like we are in a time where mental health is discussed more. It's more it's a part of our everyday conversations. But what we see a lot at our therapy practice is people that are on kind of the spectrum of a mental health disorder, right? It's maybe not the level of severe depression or anxiety, but there are some signs and symptoms that kind of indicate, hey, like maybe it is time to get a little bit more support. And we want to really acknowledge that because we don't want someone to wait until it's severe to then get support, right? There's so much work that can be done prior to that. And we always say, don't wait for a crisis to get support, right? Like get support when you're noticing some of these feelings. So if you're having panic attacks, if you're having persistent hopelessness, a big part of how we assess mental health is how much is this impacting your day to day? Are you withdrawing from the people in your life? Did you used to love getting dinner with your girlfriends and now you're just not interested? Are you talking less with your partner? These things that often gave you joy in the past, like, are you still finding some level of joy in them? Or are you finding that you're just not interested or have the motivation to do those? Again, that's a key to us that maybe we need to do something a little bit different here. Um, intrusive thoughts. Intrusive thoughts are sometimes an interesting term for people who have not heard of intrusive thoughts, but intrusive thoughts are usually thoughts and images that pop into our mind that can feel really, really distressing. Um, and most people have intrusive thoughts at some point in their life. Many have them throughout the day. But when we notice them start, again, really impacting our day-to-day functioning, that's when we really want to address them. Intrusive thoughts can often become louder and louder during periods of high stress. And obviously, if there's any thought of harming yourself, we really want to treat that right away, and we want to work with someone who's experiencing that immediately. So how do we access professional support? I think that can feel really, really overwhelming, right? Along with navigating the fertility space, no one else wants another to do. No one else wants to have to call their insurance and ask about who's a network or ask 5 of their girlfriends for a therapist name. Um, there are ways to make this a little bit more smoother, and I really want to highlight some of those because, again, the goal is proactive support, not reactive. So you can always talk to your fertility team. Your doctor should have some really good referrals of people that you can talk to for more in-depth support. They can also help assess some of these emotional symptoms. Your doctor hears and talks to women and their partners all day long about all of these things, including emotions. They can help assess, is this kind of typical or is this in the realm of, maybe a little bit more than we'd like it to be. So treat your OB or your REI doctor as a partner. They can really help support you through this. And if you're finding that they're not, that might be a time to find a new doctor because I think this is a really important component of this. And again, they should have some good referrals to reproductive mental health specialists. If not, they'll likely be able to talk to a social worker or someone else in the system that can guide you to the right next step. And when we think about mental health support, we really like to think of it in a holistic way. So again, how do we partner with all of these support people to make up a team? A team throughout fertility challenges can be really, really helpful. And finding people that can kind of check the box in different ways is a really good way to support yourself or your partner or your loved one. So when you are looking for a provider, especially for therapy, this is the time to get a little bit specific, right? I don't think it's a time to see a 22-year-old new grad who doesn't have experience in all this, or someone that focuses on career changes or other things that don't relate to this. There are amazing, amazing providers that really focus on infertility, IVF and pregnancy loss, reproductive trauma. There are entire groups that this is what they do all day, every day. Those are the people that are really going to be good support people for you. Because again, it is not your responsibility to be educating a therapist about fertility treatments. We hear this a lot when people call, that they've had to kind of walk their therapist through what fertility treatment looked like. Again, that can be really counterproductive to what we're trying to do. Couples therapy. I know that a lot of us think that couples therapy is kind of the last ditch effort when it comes to, maintaining your marriage, or it's the last thing we do before we separate. As someone who works in a fairly big group practice who sees a lot of couples, this is absolutely not the case. And we really see couples thrive during these periods who are engaging in couples therapy. Couples therapy is an amazing way to work on your communication, to help your partner understand what you're going through. It's a neutral person that can walk you through some of these really challenging steps of infertility. So we do see different levels of support that can fit depending on how you're experiencing this. So we talked about individual and couples therapy. Support groups are also a really fantastic way to connect with other couples who are going through this, or other women, other men who are going through this. Um, I think infertility can be one of those things, as we've said, that can be very isolating, but also, you only know if you know, right, to some degree. And when we have a support group of people that are all going through it together, led by someone who's really well versed in this, I think many people have really thought that a support group has been one of the best things they did for themselves as they were going through this. And again, there are many of them out there. Um, Usually someone on your fertility team can help kind of guide you in that direction. So what happens when it feels like therapy might not totally be enough, or some of these things just aren't working as well as we want them to? Medication is also a great thing to talk to your doctor about. Medication, the way I like to describe it, is it's really just another coping strategy and tool that you can use when you're going through really difficult times. It doesn't have to be forever. It can be for a very specific period of time. And there's really amazing research that's been done that medication during fertility, during pregnancy is really, really safe. Um, Again, your doctor would be a great person to start that conversation with. There's also really amazing reproductive psychiatrists that, if you do want, the full information and full knowledge base of a medication, they can spend literally an hour talking through, risks and benefits of being on medication. So I think it's an option that can be a really good one too. And when we do feel like all of these things just aren't really working in the way that we need to support ourselves, we do have higher levels of care that we often refer people to. And again, that can be a discussion with your therapist, your doctor, psychiatrist. The point is that there are a lot of options out there to really support your mental health. And I think that's maybe it.
Yes.
Yeah.
Thank you
Um,
so much, Lauren.
yeah. Yep.
Um, I would like to now open up the floor to questions. Um, I have a couple that I could start with if no one else has any that they would like to put forth. But audience first, I guess.
And you can also type in the chat too, if that's easier.
Yes. All right. The first one that I'm going to ask is something that we touched on when we spoke yesterday, Lauren, as it relates to kind of postpartum struggles. Oftentimes we see people get pregnant after infertility struggles, a long period of time going through medications and, pregnancy loss, etc. Um, so I would love to hear more about kind of what we can do to support postpartum anxiety and that type of struggles in patients who have previously, gone through infertility treatments and have been part of this, um, I guess, workflow for an extended period of time, who do find themselves pregnant and do find themselves, able to give birth to a child, but then, are hit with postpartum afterward.
Yeah. Yeah, we see this a lot at our practice. We see a lot of people who have struggled with infertility have had this really long period of time to get pregnant and then ultimately have a baby, we see them often have being at a higher risk for anxiety in the postpartum period. And I think there's a lot of factors that go into this, but I think through infertility, the goal is so focused on being pregnant and then having the baby. There's not always a lot of thought about, okay, well, what actually happens when the baby comes? Because that's a challenging time period too. And there's not a lot of preparation that's going into that, right? We're really good just in general of preparing for the baby to get here. We have our Amazon list, we have our baby showers, we've got all of the swaddles that we could need, but we also need to figure out like what we're going to do to support ourselves and support our partners and loved ones. Um, and again, I think that's when that proactive mental health support really comes in. Um, because if you're someone that's struggling with infertility and maybe already are struggling with some anxiety, I think we really need to be realistic in planning for that because that will not will, but it may creep up in the postpartum period as well.
Excellent. Thank you. And then another one that I kind of gave some thought to was uh, a lot of this is geared towards a very specific subset of the population demographically. So I was just wondering if I could get your 2 cents on how kind of cultural, socioeconomic, and even gender factors can influence mental health outcomes in infertility, and how can we kind of broaden those to be can we broaden those to be more adaptable and culturally sensitive and accessible to, as wide a range of people as possible?
In terms of mental health.
Yes.
Yeah. Yeah. I mean, you're right. I think all of these subsets of people, we do see higher risks of mental health conditions in general, but certainly in the perinatal period. I'm actually at a presentation or at a conference right now that's really highlighting some of these discrepancies and how some of these things like really prevent access to care because there all are cultural considerations when it comes to therapy. Some cultures are less likely to seek therapy than others. But I think it's about having the conversations and also finding a provider that might identify in the same way that you do, right? Like I think sometimes there's a lot of power in being with a therapist or a provider that we can really relate to on many levels. Um, but I think it's something that we're always battling of really trying to connect people to care when they really need it.
And then any questions from the audience? I have one last question if nobody has any other ones to ask. Give it a minute. Okay. And then so last question for me is just kind of what coping strategies and communication techniques, I guess, can couples use to maintain their own relationship resilience and sexual intimacy during infertility treatment? I know we kind of talked about setting aside time in which we don't even talk about anything related to fertility, infertility, kids, etc. But what else can they do to kind of make sure that their relationship is in a place that it is at its strongest to kind of move through this process?
Yeah, I think that's a really good question because it can go either way with fertility, right? It can really push people apart, but it also can bring people together. And I'd encourage couples to really see this as a team effort, right? It can often feel like you versus the other person, but when we see this as we're working together to achieve a desired goal, it can just kind of help smooth things over a little bit. And I think, the opposite of having scheduled time to not talk about fertility, I think it can also be helpful to have scheduled time to talk about a check-in, right? Like a Sunday night 10-minute check-in of like, this is how we're feeling about where we're at right now. This is what we think the next step should be. Because a lot of times couples disagree about what the next step is. And I think that can cause a lot of conflict, but if we can really identify the reasons behind that, again, I think we can see this as a team approach. But it certainly is a challenge for sure.
Excellent. All right. Well, if no one has any further questions, I'm going to take this opportunity once more to point out that the Chicago Coalition for Family Building is having our yearly 5K fun run and family day on September 20th of this year. QR code for more information. Thank you so much for joining us for this very important webinar. Thank you, Lauren, for being such a great host who, is so well versed in this subject. Um, we have a couple of other webinars coming up, so we will share that information shortly, and we hope to see you at future ones and hopefully at future events as well. Thank you so much.
Thank you.